Ready? You ready to go?
15-month-old Quasar has a standing playdate
Let's go play.
with the automatic pool cleaner.
The tail comes up out of the water and actually squirts water somewhere else. So she's undecided whether to continue chasing the Polaris or go after the water.
But a year ago, Quasar was more likely to be seen lounging by the pool than running around it. And when Jeannie Whiteman realized her puppy had no spring in her step, she was worried.
When she was about 5 months old, I noticed that her rear did not seem to be developing like I thought it should. She definitely wasn't doing things that other puppies her age would normally be doing. She wasn't jumping on furniture. She wasn't jumping on people. She wasn't doing the little fox terrier spring in the air that most of them do. We actually were taking her on a walk one day, and she just went up in the yard and just lay down. She didn't want to go anymore.
At 4.5 months old, Quasar's legs looked small and withered.
Fox terriers are very, very muscular, and they're known for just jumping and leaping, and those back legs are supposed to be very, very muscular and very strong, and hers weren't. Good girlie.
Quasar was diagnosed with severe hip dysplasia in both hips.
Good girl. And she already had enough degenerative joint disease that it limited what we could do to help her.
Arthritis had already made walking difficult for the puppy.
Hey guys!
Hi.
How you doing?
Great.
And without surgery, the terrier would become crippled.
She looks great.
Come on, Quiz. Good girl.
Hello, Jeannie.
Hi, how you doing?
Fine. How's Quasar getting along?
She's doing wonderful.
So let's take a look at this film right here.
Dr. Rick Marinson didn't expect hip dysplasia, but x-rays don't lie.
Fox Terriers are not known for having dysplasia. Being an inherited trait, we certainly see it more in certain breeds. We look for it harder in certain breeds. And while orthopedically there are certain problems that they have, for instance, luxating patellas or kneecaps that won't stay in place, that's the type of thing we're looking for. Those hips are horrendous. I mean, I was even surprised at the magnitude of defect that this little dog had. You can see how the right is partially subluxated, the left completely luxated out of that joint, and without some surgery, this dog was going to end up with some terrible crippling arthritis.
Dr. Marinson referred Jeannie to Dr. Yatsik Dahan.
Hi, Miss Whitman. How are you?
Hi, I'm doing great.
How is Quasar?
Well, I think she's doing wonderful.
Oh,
I
excellent.
would like your opinion.
Hi, Quasar. How are you? Oh, she seems very happy. Could we put her on the table, please?
Sure.
Hi, Quasar. How is her health otherwise?
Seems great.
Eating, drinking, running,
Oh, yes.
being bad?
Oh, yes. I keep telling her she's bad to the bone.
Already? Okay, let's turn around here.
Quasar's bones were bad in comparison to a normal hip joint.
In normal dogs, the ball portion of the joint should be nice and round, and in her case, it's not. And also the shape of the socket is very deformed as well.
Smooth Fox Terriers are too small for a total hip replacement, and Quasar's hip joint was too arthritic to repair.
Based on her size and clinical signs, we elected to perform femoral head ostectomy, FHO. That stands for removal of the ball portion of the joint. Function of the joint is replaced by muscles and tendons.
This prevents the bone from rubbing against the socket.
Looking at the x-ray that we took immediately after surgery, you can see that the femoral head and neck was removed, so there is no ball. And function of the joint is replaced or will be replaced by muscles and tendons.
But bottom line, has the repair worked?
Yes, like twice as much pep as she had when her little legs were
That's
hurting.
great. That's excellent. She has good range of motion of her hips.
Right.
She has essentially normal extension and flexion as well with no discomfort. That's excellent. Which means that she can run, play with other dogs, chase ball, things of that nature. She should even become stronger than she is right
Just the
now.
stuff she loves. Okay, thank you very much. All right, want to go for a walk? Let's go.
Today, Quasar looks and acts like any other smooth Fox Terrier her age. Recovery was the easy part.
Her therapy was to walk and to run and to play and to swim and just do all the things that she loves to do. So it was really good therapy. She rehabilitated herself to a large degree. Come on, Chris.
And for Jeannie and Quasar, that's a reason to say hip hip hooray.
Good girl. That's a girl. Yes.